Welcome to CNTV. I'm Brad Clonch along with Quinn Tran. The Chickasaw Nation Department of Health has put several safety measures in place during the coronavirus pandemic.
The latest measure involves COVID-19 testing in the Obstetrics Department.
Upon arrival for delivery, patients and their support person will be tested using the COVID-19 rapid tests. Results are in within 30 minutes to an hour. The test result must be received for the expectant mother's support person before that support person is allowed to go into the unit with the patient. Healthcare officials ask that the support person minimize trips to and from the hospital. These measures safely allow a support person in the delivery room and helps protect patients, babies, and the medical staff.
COVID-19 has also transformed emergency medicine. Here's more from our recent conversation with Dr. Crystalle Evans, Chief of the Emergency Department at the Chickasaw Nation Medical Center.
Really quickly, we realized early on that COVID was changing the landscape of medicine in terms of transmission and having us rethink the way that we do patient encounters, separating the sick from the not sick and reconsidering our disinfection processes here in the emergency department and in the hospital. Something that the emergency department has implemented is an ED triage parking lot process. So traditionally, if a patient comes to the emergency department, they walk in the building and they're greeted by someone that helps them check in. And then from there, they may be asked to sit down in the lobby. And then from there, they go to triage and registration, and then maybe asked to go sit back in the lobby even after that process. And then they're called back to a room. I mean, sometimes that happens successively, but sometimes not. And so for us, we are basically trying to take away the place from the process. And so for select patients, it's really for mild walking well patients with minor issues, creating a process where patients can actually drive through and never have to get out of their car. And we complete registration and we complete triage and physical exams out in the parking lot while a patient waits in their car.
Dr. Evans, I'm trying to visually see the scenario there. So you have tents set up where patients, if they are typically going to the ER, going through a process, the drive-through process that way, right?
Yeah, so we have arranged basically a flow of the parking lot. It's one way, it's unidirectional. And so what patients will encounter when the tents are open is there'll be a first tent at which they stop, a screening nurse who introduces herself or himself and says, "What are you coming to the emergency department for today?" And depending on the reason for the visit, the patient may be directed to go to the emergency department, or they may be directed to go through the tent process. And from here, the patient is actually handed a piece of paper on which they put, their personal identification information, and then they drive to a next. They're directed to go to a next station, and their registration will meet them. And it's a hands-free process. So they hold up the paper, and a picture is taken of their information, and it's scanned into our electronic medical record system, and they're able to be registered without ever making contact. And then once the patient is registered, they drive forward to a triage station where a triage nurse will come and speak with them and get more information, a more detailed history, take vital signs. And then, sometimes there we determine there's a need for emergency evaluation. And so we will either direct the patient to the emergency department, or we say pull forward and go park in this parking spot, and a provider will come out and meet you and talk with you and examine you in your car.
We're discussing how the ER is evolving or transforming because of the pandemic at the Chickasaw Nation Medical Center. Yes. How has the pandemic affected the clinics?
We had to ask ourselves the questions, how can we reach out and provide access to patients when they can't physically come here? And so in many ways, I think a lot of discussion has been around virtual visit appointments. The medical community is experiencing a technological renaissance, so to speak, and in that virtual visit appointments have just been catapulted into the dialogue. And so we're finding ways to connect with patients and provide care without that traditional in-person, experience. And I think I would say that's the biggest impact on clinics is just thinking outside the box, kind of like what we're doing, coming up with unconventional ways that I do believe are going to be the new convention moving forward. This organization, from our outpatient primary care clinics to our specialty clinics, surgery, women's clinic, our inpatient teams, our administrative leadership, we have really just banded together to collaborate to ensure that we as an organization are here for our patients to provide the highest quality of care that we strive for.
In the next episode of CNTV, we'll take a look at pharmacy services, the state-of-the-art technology and the work that pharmacists and staff are doing to meet the needs of patients.
Meanwhile, families continue to find ways to do things they enjoy with responsible distancing in mind.
We first met Chickasaw artist Risa Wilkins McKinney last summer, her first summer as an instructor at the Chickasaw Nation Arts Academy. She owns a children's art studio in Edmond, Oklahoma, and has been doing porch art for her young students during the pandemic.
I pre-sketch simple things. I've done a lot of pet portraits, let me tell you, people's pets, that they either pop art or paint realistically, or if they want to do a unicorn or a horse or an owl. I keep it wide open. One sketch, depending on what they choose, could have 12 to 15 different colors. So what I do is I bag up little portion cups of plenty of paint. And I always try to throw in a few little extra little baby canvases so they'll do their own thing on them too. So what I do is I put it together in a little kit. I take it to their house. I drop it on their porch. I text them and say, it's on your porch, delivered. And I think this brings them a little minute of happy, like just a little bit of normalcy, a little bit of happy, a little bit of, you know what, it's going to be okay. Some things have not changed.
The porch art has been popular with families, but she hopes to have small groups of children back in her studio this summer.
The Chickasaw Press receives 2 prestigious literary awards. Protecting Our People, Chickasaw Law Enforcement in Indian Territory earned an Oklahoma Book Award for design. This book highlights the Chickasaw lawmen who served as light horse officers, sheriffs, and other law enforcement roles. Chickasaw Adventures, the complete collection, received the Ben Franklin Gold Award. The comic book collection creates a unique graphic novel that brings the history, language, and culture of the Chickasaw people to life.
From the Chickasaw Press, we leave you with another tale from Chickasha Stories.
This one features Duck and Coyote. See you next time.
Out near the river lived a duck with her little ducklings. Early one morning, she told her children to go to the river for their baths, she said. I will sit on the bank and sing for you. When the song ends, jump in all together. As she sang the last word to her song, the little ducklings jumped in the water and went under the water. They came up far away from the bank of the river and swam around until they reached their mother. She sang her song for them again and again. Each time the little ducklings ducked in and swam around and around. Coyote heard Mother Duck singing. He said, "How pretty you sing to your children. Maybe I should go for my children, so you might sing your song to them. Please tell me how your little ones stay on top of the water." Mother Duck said, "It is because they have the great power of a bobanili to stay on top of the water. And if your children have the same power, they can stay on top of the water too." Coyote went off to get her children. She brought them all to the riverbank and asked Mother Duck, "How shall I sing the song? Do I call their names as I sing?" "Oh yes, your children must hear their names before they get into the water," said Mother Duck. But the little coyotes were afraid of the water and wouldn't go near the river. They all gathered together on the bank, so Mother Duck started to sing for the little coyotes. "When I get to the end of my song, jump into the water." She got to the end of the song. All the little coyotes ran off for home as fast as they could. Coyote still tries to sing for her children, but she still can't get them near the water to this day. Little coyotes run for home when Coyote starts singing her song.